Okay, so our lesson for today is about radiographic definition and distortion. So dito napapasok yung mga geometrical factors. Okay? In the previous lessons, we discussed about the photographic factors. Okay? So when we say definition, it is or it describes the clarity and sharpness of the image. Okay? So uh, when we say definition when pertaining to our image, ito yung linaw saka uh, yung bang walang labo, walang blurring sa image. Walang blur parts. Okay? So the term definition means to make definite, clear, refers to the sharpness, outlines of the images, and particularly to the minute markings. Yung minute details, kailangan ma-differentiate or makikita pa rin when we say definition. Okay, so ano kaalaga ng definition? Okay, so it is important that our images, okay, that the definition of our image remains clear and sharp para pagdating sa interpretation, sa reading ng image is walang magiging problema ang radiologist. Hindi magkakaroon ng misdiagnosis. Okay. So there are inherent limitations in radiography that prevent the production of a perfect radiograph. So of course, yung definitions naman, of course there are certain factors that we need to consider, in order for us to produce a good quality radiograph. Okay. So ano yung mga inherent limitation? When we say inherent, di ba, kumbaga, nandun na yon, given na yon, wala na tayong or wala tayong magawa na ma-eliminate yon. Instead, ang pwede lang natin gawin is to reduce or to either to reduce or to avoid. Okay, so example nito yung mga anatomic part of interest which is inside the body, okay, and therefore cannot be placed next to the film. Okay. Remember that general principle, kapag tayo ay nag-X-ray, diba, the part to be examined should be closest or should be placed closest to the image receptor. Okay. So, ang ibig lang sabihin nitong statement na to, yung anatomical part of interest inside the body, inherent siya. Kasi nga, like, example, X-ray of the lungs, chest, di ba, of the lungs. So, hindi naman natin madidikit masyado yung lungs sa ating image receptors due to the anatomical positions or anatomical structures na nasa pagitan ng lungs at ng ating image receptor. Such as the ribs, kapag PA, di ba, yung ribs, yung ating muscles. So, ganun din pag naman AP, yung ating scapula and etc. Yung vertebra, ribs pa rin sa mga muscles. So, yun yung ibig niyang sabihin. Hindi natin didikit masyado doon sa ating image receptor yung part to be examined. Okay. So this causes the part to be recorded larger than its actual size. Okay? So, nagkakaroon ng magnification. Okay. So in radiography, the true object recorded on the film is called umbra. Okay? And the small or thin area of blurring is around the umbra is called penumbra. Okay. So, technically, pag sinabi nating umbra, okay, ito yung shadow, ito yung image na nabubuo. Okay? Ito dapat yung image na fine yung detail, yung definitions niya is clear and sharp. However, due to certain inherent factors, nagkakaroon ng penumbra. And the penumbra is called unsharpness. It is also known as unsharpness. Okay. Penumbra is the blurring around the umbra. Okay, so radiographers cannot completely eliminate penumbra. However, it can be minimized so that the image quality is not compromised. So katulad na sinabi ko sa inyo kanina, na yung mga inherent factors na yan, hindi natin yan ma-eliminate. Okay? But instead, we can either avoid in some instances or minimize the those factors, inherent factors. Okay? So recorded detail naman is the actual or visible detail of the part of interest recorded on the film. Okay? Recorded detail. So recorded detail is dependent on the following factors. Okay, of course, the geometric factors, we have the FSS, FFD, and OFD. Okay, ano ibig sabihin ng FSS? Focal spot 2. FFD, focal spot 2. OFD, object 2. FFD, focal spot 2. Film distance. OFD, object to film distance. FSS, focal spot 2. Focal spot 2, size ba? Sige, mamaya tingnan natin kung ano yung FSS na yan, ha? Nagbabasa ba kayo ng Burns? Sa Burns na po ito, ha? Galing na sa Burns. The number 4, absence of object movement. Then 5, type of recording system used to produce image. So again, yan. So yung tatlong geometrical factors plus the motion or absence of motion, then type of the image receptor or the recording system. Siya ba ay digital, siya ba ay film screen, or siya ba ay VR or CR, okay? So FSS is focal spot size. Okay? Okay, as you can see in the image, okay, nakadepende sa focal spot yung kung gaano ba or yung kung gaano malaki or maliit ba yung penumbra. Kaya nga, di ba, in the previous meeting, sinasabi ko sa inyo, kapag small body part, ang ginagamit ay small focal spot. Bakit? Para yung sharpness ay or yung image ay mas sharp. Okay, para ma-view yung smallest detail. So it turns out na if you use small focal spot, maliit lang din yung penumbra. Yung unsharpness. Okay? And when you use large focal spot, malaki yung penumbra compared sa small focal spot. Okay?
Sir,
Yes.
yung focal spot po ba is connected dun sa collimator?
The focal spot is siya yung nandun sa anode. Diba? The meron tayong focusing cap, tama, sa cathode. The focusing cap is directed towards the saan, sa target, 'di ba? Yung target, yun rin yung focal spot. Yun rin yung focal spot na pinatatamaan. 'Di ba we have two focusing cap or two filament, yung small saka large filament. So yun yung nagdi-dictate kung saan patatamain na focal spot na target. Large ba or small. Ito yung merong angulation din. Mamaya, titingnan natin kung may image dito. Small na filament, tatama siya sa small focal spot.
Ay, okay.
Large filament, large focal spot. Yan ay may selection yan sa ating control console. So sineselect yan ng RT before a particular procedure. Or kapag naman may mga pre-saved, preset na mga sets ba for the skull, i-click mo lang yung skull, automatic na doon kung large ba siya or small focal spot. Pero kung manual mo gagamitin, so you have to select manually if small or large focal spot yung gagamitin mo. We only use small focal spot for extremities. Okay? Pag mga chest, abdomen, so we use large focal spot. Okay, so ayan nga yung sinabi natin. So, large focal spot size results in an increased image unsharpness. Okay. As they travel tangentially across the edge of the anatomic part of interest, the outer edge of the object receives X-ray photons from all areas of the focal spot to help record the image on the film. So the effect produces a fuzzy, unsharp border around the area. So dito nagda-diverge ito yung sinasabi ng statement. Okay? Dahil sa yung tangential, when we say tangential, parang padaplis. Okay? So, pag tinamaan nga naman siya dito, parang dumaplis lang sa gilid. Okay? However, dahil sa malaki yung focal spot niya, malaki yung area na kung saan tinamaan ng radiation or doon yung directing the primary beam. Okay? So, ayun, malaki yung area of unsharpness. Okay. So, evidently, the smaller the focal spot size, the greater the image sharpness. Okay? Kaya yun nga yung ginagamit natin sa mga small body parts para mas ma-visualize natin kung mayroon bang, let's say sa bones, may fracture ba or mayroon bang mga fragments of foreign bodies, etc. Okay? Okay, so, ayun. Sabi dito, radiographers should consult the rating charts to determine if the selection of the focal spot size and technical factors are compatible with the specific X-ray tube. So, ano ba yung tinatawag na rating chart? So, yung rating chart or tinatawag din niya na technical factor chart. So, dyan naka-indicate yung mga body parts, tapos ano yung KBP, ano yung MAS, at ano rin yung focal spot size na ginagamit. Including na rin dyan yung SID na gagamitin for a particular procedure or routine. Okay. So usually, may kasama na yung chart yan sa galing sa manufacturer. Pero nonetheless, depende pa rin yan sa QA/QC officer kung ano yung magiging standard na technical factors and other factors na nandun sa rating chart. So kung walang QA/QC officer, so usually ang sinusunod dyan is yung galing sa manufacturer. Okay, now we have the FFD or focal spot to film distance. Or tinatawag din siya na SID. Okay. So long SID, it produces a small penumbra. Short SID produces large penumbra. Okay? And it also causes magnification. Okay? So long SID, let's say sabihin natin this is 40, 42, 42 inches. Okay? So the penumbra is small. Then kapag pinaba mo siya, let's say this is just let's say 20 inches. So yan. So of course, doon sa angulation dito sa kabila, may small. Pero pagdating doon sa kabila, okay, large na yung penumbra. At the same time, may magnification na mangyayari sa image produced. Okay. So X-ray originate from the surface of the focal spot, okay, and not from a single point source. So, yun, sa focal spot nga kasi dun yung target. Okay? And then photons that originate from these different points pass tangentially across the edge of the object and record the information in a slightly different area. Diba? So dito tangentially, okay, instead na ito yung laki ng image mo, ito yung mapupunta sa iyong image receptor sa film. So ang mangyayari, hanggang dito siya. Ganyan yung inilaki ng iyong image, minagnify. Okay? So, hindi lang mula dito, kung hindi pati dito, kasi ito yung ano mo eh. Ito yung penumbra mo. So yan, yung image yan, ganyan kalaki. Compared mo dito na, mayroon siyang, ang sharpness pa rin pero hindi ganun kalaki. Pero yung image mo, hindi naman siya sobrang nag-magnify. Unlike dito, talagang obvious yung magnification niya.
Sir, regardless po ito ng size ng focal spot.
Regardless ba, well, nabanggit natin yung focal spot kanina. So, yung rule doon, of course, mag-apply din dito. Let's say, gumamit ka ng small focal spot, tapos long SID, of course, is small penumbra. Pero kung kahit na gumamit ka ng small focal spot, pero ibinaba mo or niliitan mo yung distance, yung SID, so magkakaroon pa rin ng magnification. Regardless siya kung small ba or large yung focal spot. Okay? Okay. Kasi doon sa focal spot kanina, when we talk about focal spot, di ba, ang pinag-uusapan lang natin doon is yung area of penumbra. Small focal spot, small penumbra area. Large focal spot, large yung penumbra area. However, pagdating sa SID or FFD, okay, kapag long SID, small penumbra, kapag short SID, large penumbra and magnified image. Yun ang difference nilang dalawa. Naintindihan po? Okay. Therefore, okay, we must utilize the longest FFD that is practical to minimize unsharpness. Kaya nga kung mapapansin ninyo, may mga fix na SID per procedure. And usually, kapag yan ay standing or BCH, okay, kapag yan ay BCH, usually ay 72 inches. Okay? Kapag naman table, it's either 40 inches or 42 inches. Okay? So dito sa slide na to sinasabi is for mobile examination, that is for bedside radiography. Okay? So 35 inches ang SID. And for table studies, 40 inches. Okay? Linawin lang natin yung 40 inches. 40 inches kapag tabletop. Mali, baliktad pala. 40 inches kapag baki, 42 inches kapag tabletop. Okay? Ganon din sa upright chest examination. Okay? 72 inches kapag wala siyang grid or baki, kapag walang baki yung BCH. Okay, kapag may baki or grid yung BCH, so that is 70 inches. Okay. So now we proceed to the OFD, or the object to film distance. Okay. So this is our source. Okay. Source of radiation, pero sige, for the purpose of this topic, so source of light. So this is the object. Okay. When the object is closer to the or says delta I object to film, when the object is farther from the film, malayo siya sa image receptor, okay, at malapit siya doon sa source of light or source of radiation, so lumalaki yung kanyang image. Okay? At the same time, paglaki ng image, lumalaki rin yung area of unsharpness. Okay? Okay. In contrast, kapag yung object ay mas malapit sa image receptor, okay, kung ano yung size ng object, it is much closer or much closer yung shadow niya or yung image na ma-produce doon sa size ng object. Kaya nga, binanggit ko kanina, as a general rule, okay, lagi nating sinusubukan that the part of interest or part to be examined should be closest to the IR. Okay? Dapat siya dikit sa image receptor as much as possible. Okay? Para makuha natin yung accurate size ng object at the same time yung kanyang definition or recorded detail. Okay? So, yan. Place the anatomic part of interest as near the film as possible. The shorter the OFD, okay, the greater the image sharpness. So, ito na yung relationship. Ito yung dapat natin tandaan. Okay? So, OFD is a factor in size distortion. Okay? As OFD increases, so does the image unsharpness, sabi nga natin may unsharpness, and may magnification, size distortion. Okay? Question, OFD, naintindihan po ba? So, sa inyong bahay, pwede nyo gawing experiment, yung kamay nyo, ilagay nyo under a flashlight, and then yung flashlight, steady nyo lang, tapos ilayo nyo sa flashlight or ilapit nyo sa certain uh, wall yung kamay. So makikita nyo kung may magnification, may blurring, or kapag nilapit nyo ba sa pader habang nasa ilalim ng flashlight yung kamay, ano mangyayari doon sa shadow? Makikita nyo naman yon. So para ma-verify nyo kung totoo ba na kapag shorter ang OFD ay greater ang image sharpness. At kapag naman in-increase natin ang OFD, magkakaroon ng unsharpness and size distortion. Then of course, motion. Siyempre, motion is the number one enemy. Yan ang number one enemy natin kapag tayo ay nag-perform ng any radiographic examination. Kasi once na gumalaw ang pasyente, magkakaroon ng unsharpness. Okay? Yung recorded detail, okay, lalabo. Okay, pag tiningnan natin yung film under the or sa negatoscope or sa view box, talagang minsan yung ribs, halimbawa kung chest yan, yung ribs, okay, talagang makikita mo na gumalaw kasi may overlapping ng ribs, etc. Okay? So motion, number one yan. Kapag gumalaw, may unsharpness. Okay? So visibility of detail, okay? Low blur, okay? Low blur, katanggap-tanggap yan. Medium blur and high blur, of course, that is a no-no for radiography. Okay? So, dito, yan, kailangan natin dito maganda yung kanyang recorded detail and definition and wala kang sharpness. Dapat, okay? So, ito ay x-ray ng foot. So, ang ginagamit dito ay small focal spot. Tabletop, ilang inches? Ang SID, ilang inches ang SID ng tabletop?
42.
Okay. Pag tabletop, 40 inches. Okay. So again yan, sabi nga natin, biggest enemy of producing a good quality radiograph is motion. Okay? So if the part moves during the exposure, so detail cannot be accurately recorded. So two characteristics of motion. Okay, so two types of motion. We have voluntary motion. Okay. movement of extremities, body movement, and breathing. So that means it can be easily controlled by proper instruction or use of restraints. Example, sandbags. Of course, kung may voluntary motion, may involuntary motion, such as the movement of the GI tract or yung tinatawag natin na peristalsis or peristaltic movement. Okay, the cardiovascular system, particularly the heart. Okay, then or patients who are unconscious and cannot hold breaths for short periods of time. Okay? So ano yung magiging solution for the involuntary motion? So the best solution is use the shortest possible exposure time. Okay? Ang dinidecrease natin ay exposure time. Okay. So we have different restraint devices. Okay, this is a pigostat. Okay? Ito ay restraint devices for chest x-ray ng mga pediatric patients. Okay, hindi lang chest x-ray, pati abdominal x-ray. Okay? So however, meron siyang disadvantages because it can produce artifacts. Okay? Magkaroon ng plastic, parang balot na plastic kapag na-produce yung radiograph. Okay? So, nakakita na ba ako ng pigostat? Hindi pa. Sa picture lang. So, wala pa akong nakikita ang hospital na may pigostat sa Philippines. Okay? So, kasi kung meron ang bawat hospital na ganyan, napakadali lang mag-x-ray ng pediatric patients, no? Isushoot mo lang dyan yung pasyente, yung bata. Oh. Wala na, kahit mag-iiyak yung bata dyan. Diba? So again, that is the pigostat. Okay? Then we have the restraint boards. So restraint board ay, okay, infant immobilizer. Okay? So meron siyang, of course, velcro, may mga strap siya para may strap yung body ng pasyente. Yan. Yan ang example ng restraint boards for infants. Okay. So abdominal x-ray, chest x-ray, so kuha-kuha na yan. So however, may disadvantages kasi you have to increase the technical factors kasi medyo makapal yung board. Okay? Then modification of the Velcro strap restraints board is the octa-stop board or octagonal metal frames are attached on the end of the board. So, yan. Octagonal kasi, yan. Octagonal, 8 sides yung cylinder niya, yung pangalan niyan. Basta may 8 sides yung magkabilang dulo. So, restraints, okay? Siyempre, naka-protected yung ulo. Naka-strap yung buong body ng pasyente, ng baby. So, yung pati kamay niya dapat ay properly positioned. Nasa gilid lang yung kanya mga kamay. Okay? So again, katulad ng pigostat, wala pa rin pa ako nakikitang ganyan na immobilization or restraint devices. Okay. Then the next factor is of course the recording system. Okay. Film screen combination or either sa pag digital either CR or DR. Okay? So ano yung mga factors to be considered kapag film screen combination? The film graininess. Ano yung graininess ng film? Ano yung sinasabing graininess? Yung dami ng silver halide crystals and size ng silver halide crystals. The screen structure, siya ba ay single emulsion, double emulsion, okay? And of course, the screen motel or what we call the quantum motel or noise. Yan yung mga uh, kailangan natin na alamin. Okay? In order for us to have an effective screen film combination para sa magandang recorded detail. Okay? So film graininess and refers to the inherent uneven distribution of silver halide crystals in the emulsion. So dami at size yan ng silver halide. Okay? Screen structural defect. Okay? So at the same time, kung siya ba ay of course yung sa ating screen combination, rare earth ba yan? O dapat parehas yung film or yung film and your screen is compatible with each other. And then the quantum motel, okay, fluctuation in the number of photons absorbed by the screen photons. Okay, and therefore it affects the light photons that the film absorbs. Okay. So the multiple energies in the primary beam allow the fluctuation in the photon absorption by the uh, screen result in non-uniform exposure to the film. Diba? Hindi na, alam natin na hindi naman pare-parehas yung energy ng X-ray photons na naproproduce sa ating anode. Okay? Kaya nagkakaroon ng non-uniformity ang exposure ng ating film. Hindi lang yun, pati rin yung kapag tumama na yung primary beam sa anatomical part, so nakadepende na yun sa uh, attenuation, sa absorption ng photon. Okay? At doon nga ay makakapag-produce tayo ng image. So motel, ang motel ay sabi ito, it looks like a snowy television screen. So, I don't know if familiar kayo doon sa mga televisions na kapag walang program or pag walang channel or walang ano ba, paano ba sabihin yun? Walang signal, particular channel. Yung para lang siyang white siya na parang gumagalaw-galaw, parang static. Inabutan niyo ba yung mga TV na gano'n? So yun yung parang pag walang cable or walang signal galing sa antena, nagaganon. Yun yung motel na tinatawag. Okay? So, sa radiography, so motel prevents the recording of a good detail. So quantum motel is more evident in high-speed screen. An exception would be screens where the layer of phosphor has been increased in the thickness to produce faster speed. So the manufacturers screen using new technology. So ayan. So nakadepende sa thickness ng phosphor layer. Okay. kapag mas makapal yung thickness ng phosphor layer, okay, mas mabilis yung speed niya. Okay, yung screen speed. However, new technology daw ay nakafocus ngayon sa hindi sa thickness, kung hindi doon sa quality ng phosphor na nilalagay. Kung magandang quality or efficient yung phosphor, so it is better than to increase the thickness of the phosphor, thus producing uh, speed or increasing speed to the film screen combination. Okay. So first, screens with a thicker phosphor layer will absorb more photons and require the MAS to be reduced. Okay. The increased thickness of the phosphor layer produces more light diffusion, which obscures the motel. So yun yung solution in order um, to minimize the motel problem. Kaya ang ginawang solution ay to increase the thickness of the phosphor layer. Okay? So rare earth systems are more efficient than the previous phosphor na ginagamit sa mga IS natin. Okay? So kapag rare earth yung ating phosphor na ginagamit, so we must also use a more a compatible film. Kailangan compatible yung film na ating gagamitin. Kasi kung hindi tayo gagamit ng compatible film, walang silbi yung rare earth. Okay? So kung hindi sila compatible, mabilis nga uh, yung rare earth system. Pero yung film na ginamit ay hindi naman siya pang rare earth system na IS. So, walang effect. Okay? So, dahil sa rare earth systems ay efficient phosphor, so mga rare earth IS ay hindi kailangan na makapal ang phosphor layer. Okay? So quantum motel is easier to recognize as the film speed and screen speed increase. Then MAS is reduced and patient receives less radiation. Okay? However, fewer photons will be available to produce the image. So yan yung reason why uh, the use of IS contributes to the reduction of patient dose. Okay? So yan yung reason kung bakit uh, ang paggamit ng mga IS ay nakakatulong sa pagbabawas ng radiation dose ng pasyente. Okay? So quantum motel is significant with high KBP and low MAS exposure used with fast imaging systems, particularly the rare earth systems. Okay? And then quantum motel will obscure recorded details. So kaya kailangan ay gumamit ng fast na film screen system. Then image resolution. Okay? It is the term used to evaluate the film screen system's ability to record detail. Resolution. Okay? So, ito ay may test na ginagawa dito sa QA/QC, sa Quality Assurance and Quality Control. Okay? At ang ginagamit na test dito ay yung bar test pattern. Okay? Bar test pattern is used to measure, okay, the ability of the imaging system to provide good image resolution. So yung test pattern, ine-x-ray siya, okay? Then, of course, pagkatapos mo x-ray, de-develop mo, tapos, yan, titignan ng radiographer or ng QA/QC officer, okay, yung radiograph to determine the number of line pairs that can be visualized. So one line pair is one line bar and one interspace. Okay. So the higher the number of line pairs per millimeter that are visible, the greater the resolving power or of the imaging system and its ability to record detail. So mas maraming line pairs na makita sa na-develop na radiograph during the assessment. Okay? So meaning mas maganda yung ability niya to or mas mataas yung kanyang power to record detail. Okay? So sabi dito it is 8 to 10 line pairs. Okay, per millimeter. Okay, yung ideal na good screen film system. Okay, again, it is 8 to 10 line pairs per millimeter. Okay, ano yun, di ba, per millimeter? Sobrang liit yun. Okay, okay, screen film contact. Okay, so it is important that the film and the screen, okay, ma-maintain yung contact niya or pantay yung surface ng contact. Kasi kung hindi pantay yung surface ng contact, so maaaring magkaroon ng warping ng image. Okay? So it can have distortion on the image. Okay? So the screen film contact is the pressure exerted by the film holder or the cassette as it encloses the X-ray film. So ano yung test na ginagawa dito? So sa QA/QC, the test used here is what we call the wire mesh test. Okay, so wala na ang explanation. So wire mesh test yun in order for us to make sure that lapat yung film sa loob ng cassette. Magkalapat yung film evenly at saka yung IS sa loob ng cassette. Okay. Kasi kung hindi, magkakaroon ng warping, magkakaroon ng distortion. And distortion is defined as the misrepresentation of size and or shape of the object to be or of the object examined. So there are two types of distortion. We have size distortion and shape distortion. Okay. So sa size distortion, we have magnification and minification. Sa shape distortion, we have elongation and foreshortening. Okay? So size distortion or magnification occurs whenever the OFD is greater than 0. So the greater the OFD, the greater the magnification. So that means OFD and magnification is directly proportional. Okay, the thickness of the body part will affect the OFD. Patient thickness And part thickness are factors that cannot be changed. Totoo naman. Di naman natin pwedeng tapyasan yung tissue ng ating x-ray, di ba? Then, it would be best to have a zero OFD, okay? But it is not realistic. Okay, pag sinabing zero OFD, let's say, ang ating examine ay KUB. Okay, KUB X-ray. Ano ba yung KUB X-ray? KUB X-ray is kidneys, ureter, and bladder. So, dapat daw kung zero FD, so nakalapat sa iyong image receptor, yung kidneys, ureter, and urinary bladder. However, it is not possible. Diba? So, at least, we must place the region of interest as closest as much as possible to the field. Okay, then radiographs are usually made with 2 to 10 inches between the part and the film. Okay, so usually 2 inches. Okay, kapag tayo ay may baki, usually hindi pala mga at least 3 inches kapag may baki. Okay. Okay, so yan yung magnification technique. This is size distortion. Diba? OFD, increase mo OFD, increase yung magnification. Okay. Mas lalaki yung body part kapag in-increase mo yung object to film distance. Okay? Naintindihan po ba? Any questions? Gising pa ba kayo?
Yes po, sir. Maganda po.
So naintindihan nyo naman yung sinasabi ko?
Opo.
Next week ang exam na pala. Okay, so okay. So OFD, OID same lang. Okay? So ito another representation or image, okay, that shows the magnification. Okay? So actually wala palang minification, nabanggit ko lang na minification is also a size distortion. However, hindi tayo nakakagawa ng minification sa radiography. Only magnification. Okay? Okay, so magnification, okay, o minimal magnification kapag small OID, and of course increase or large magnification kapag mataas yung OID. OID is object to image receptor distance. OFD is object to film distance, which is the same, parehas lang sila. Okay. Shape distortion or true distortion is present when the image does not represent the true shape of the actual object. Okay? Size distortion always presents, okay? Ang size distortion, okay, it always presents the image, the true shape of the image. However, mas malaki lang. Pero, ang shape distortion, hindi niya nire-represent ang actual image or yung true shape ng actual object. Nagets mo ba? Kasi kapag magnification, pinalaki mo lang. Pero yung pa rin talaga yung shape ng actual object. Okay? However, pag shape distortion, okay, hindi na yun yung true shape ng actual object. So we have the term elongation. So refers to an image that is stretched and appears longer than the actual size. Okay. It is produced when X-ray tube or film holder is improperly aligned with, okay, with an excessive angle. Okay? So alin po ang may angulation? Either the X-ray tube or the cassette. Okay? Excessive angulation, it will produce elongation. Okay? Ito yung example. Central ray, okay, CR. Yung CR dito stands for the central ray. Okay? Pero naka-angulate yung ano naka-angulate dito? Dito ay naka-angulate ang image receptor. Kaya naka-angulate yung image receptor. So, therefore, nagkakaroon ng elongation. So, the central ray, ito yung ano natin, object. Okay, pag na-develop siya sa film, so mula dito siya hanggang dito. Yung object, di ba? Okay, ito naman, letter E. Ang naka-angulate ay ang body part or object. Wala angulation sa X-ray tube, no angulation sa image receptor, but there is an angulation sa object. And angulation of the object also affects the shape distortion. Okay? So, magkakaroon pa rin ng elongation. Okay? Clear po ba? Questions?
Yes, sir.
Okay. Okay, so dito, okay, X-ray tube naka-angulate. Ito, perpendicular. Okay, when we say perpendicular, diretso lang yung central ray or primary beam. Okay, so wala siyang shape distortion. However, meron siyang size distortion, may magnification. Okay, so dito, compare mo dito siya ay ganito yung itsura, pero pagdating dito, nagkaroon ng angulation ang X-ray tube. So, nagkaroon ng elongation sa shape. Instead na bilog, nagkaroon ng elongation. Nagkaroon ng stretching. Okay? Okay, so, ito example. Okay? This is the normal na itsura ng hip. Okay, kalahati ng hip. Okay? Ito, nagkaroon ng angulation. So, nagkaroon ng elongation. Humaba siya. Nagkaroon ng distortion. Di ba? Oh, compare mo ito dito. Dito yun. Okay? Tapos, itong head ng femur, okay? So, halos nag-stretch din siya. Nag-overlap na siya doon sa ibang structure. Okay? Halos dumikit na siya dito sa sacroiliac joint. Okay? Ito sacroiliac joint. Okay? So nagkaroon ng elongation. Okay? So example of shape distortion due to unequal magnification. So yan. Okay? So, yan. Okay? Kung mapapansin nyo, okay? Letter C and letter B, okay, does not reflect the true shape of the object or the part of the part examined, di ba? Compare mo sa letter A, okay, may magnification lang. Okay, however, it represents the true shape of the body part. Okay? Pan pantay pa rin naman yung humerus. Okay, sa letter C, hindi na pantay yung humerus. Sa letter B, ganun din. Hindi na pantay yung humerus, malaki pa yung space between the fractured humerus. Diba? So yan, shape distortion. Dito, okay, sa letter B, elongation. Sa letter C, foreshortening. Lumiit yung space ng fracture. Parang mag-overlap sila. Okay? So, foreshortening, elongation. Ito, magnification. Okay? Okay. Sa tingin nyo, alin na elongated image? First, second, or third?
Yung first po.
Okay, very good. So this is the elongated image, the foreshortened image, the normal image of the scapula. Ano, foreshortening, elongated. Okay? Okay? So same goes here. This is the normal humerus. Okay? Foreshortened. Okay, may foreshortening. Then elongated humerus. Okay? Is another representation of the explanation for foreshortening and elongation. Okay? Same. Okay. So foreshortening occurs when the object appears shorter than its actual size. It results from poor alignment of the part and the film. So ano yung rules natin? Use the longest acceptable FFD or SID. Place the part as near as possible to the image receptor. Okay. Place the object as near parallel to the film as possible. Okay. And number 4, use a perpendicular central ray. Again, when we say perpendicular, okay, siya ay diretso lang. Okay. So, explain na natin. Hindi ko alam kung na-explain sa inyo sa anatomy, sa radiographic anatomy, ang perpendicular. Okay. Okay, perpendicular ay ganito. CR, ito yung object. Okay? So, CR, Ito yung object. Okay? Kapag naman parallel, okay, ganito yung symbol niya. Parallel, diretso. Dalawang line. Ito, pag nakakita tayo ng ganito, that is perpendicular. Okay. The central ray is perpendicular to the IR or to the image receptor. Okay. Ito naman, the central ray is perpendicular to, let's say, to the IOML or infraorbital meatal line. Okay. So perpendicular and parallel. Okay. Okay. Note, for special views of certain anatomic parts, such as small joints or articulations, job angle or part rotation may be necessary for adequate visualization of the part. So sa madaling salita, hindi naman po lahat ng shape magnification or shape distortion or size or shape distortion ay masama. Kasi siya ay ginagamit din as technique to visualize, okay, certain joints and uh, body part. Okay? Any questions? Question po?
Wala po, sir.
Wala. Okay. Kung wala pong question, so that ends uh, my lecture regarding definitions and distortions. Okay? Okay, so